If you record a pain event, 40 minutes later, the watch will buzz with a follow-up survey to ask you some additional questions about the pain. When you see this button appear, please tap on it, and it will take you to the next series of questions to inquire about the pain at the current time. The first question you'll see asks about the pain level. Right now, I'm showing you an example of the questions on the caregiver's watch. Just as the other survey, you tap on the blue square to select your answer. This is the standard 0 to 10 pain scale. When I select my answer, I'll click next. Next question again, ask how distressed are you? You can interpret distress very broadly. Perhaps I'm unfortunately very distressed at the moment. And then again, as the caregiver, it's asking me from my perspective, how distressed is the patient? Not at all, a little, fairly, very, or perhaps unsure. In this case, I'm going to say fairly distressed. Then the next question asked, did the patient take an opioid for the pain? You have three options. You can click yes, no, or maybe you don't know. In this case, I do know the patient took an opioid for the pain. If you have any questions about what we mean by opioid, please talk with the clinical research coordinator. But essentially, this is probably the primary pain medicine that the patient is taking for their cancer-related pain. It's important that we try to understand the timing of when you took your the opioid pain medication. If it was less than 20 minutes ago or more than 20 minutes ago, or if perhaps you're not sure, we would like you to select the appropriate answer. So in this case, for me, it was about more than 20 minutes ago. When you get to this question, the watch will ask you if you did anything else to help your pain. As always, you can tap through the responses using the blue square. In this example, I did do something else to help the pain. So I will tap yes, and then I will tap next. Then the watch will present you with some options of things maybe you did to help your pain. Exercise or stretching, prayer, meditation. Maybe you used a hot or cold pack, a position change, resting, massage, taking a non-opioid medication. This would be something like Motrin or Advil or Tylenol. Or maybe you did something else. So you can select one of these options and then tap next. If, for example, maybe you did two things, perhaps you used a hot cold pack and you rested. In this situation, please choose the option that you think made the biggest difference with your pain. The watch will only let you choose one option for this question. So in this example, I will say that resting made the biggest difference for my pain. So I'm going to select that option and then tap next. Again, there's another question about location to help us better analyze your data. Let's say this time I'm actually outside of the home. And then again, a final chance to either submit your answers, or perhaps you'd like to make some changes. If that's the case, tap on the blue square, and then you'll have a chance to redo the survey. So in this case, I'm going to answer the questions a little bit differently. And this time, I'm going to say no, the patient did not take an opioid for the pain. And then we'd like to understand why not. And again, there's no right or wrong answers, but this is important information for us to help understand how we can best manage cancer pain. Here are some common reasons why people might not take pain medication even if they're hurting. Maybe they feel it's not time yet. They're worried about side effects. They're out of pills. They're worried about taking too many. They don't think the pain is bad enough, or there's some other reason. So please select whichever one might apply. In this case, I'm going to say that I don't think it's time yet. And then there's a question again about, did the patient do anything else for the pain? If I answer yes to this, it will take me through the non-pharmacological pain options. But this time I'm going to say no. Again, there's one question about location. And perhaps I'm in the office of my house, which is not an option. So I'm going to choose other. And then I'm ready to submit the survey.